So hello friends, in this video we will learn about the lateral wall of nose. So this is a very important topic from the head and neck, and so let us begin. There are a few terms. First we will see those terms and then we will proceed. See, as you can see, this is a cut section from the nose, and here we can see the nasal cavity, right? So you can see that this is the lateral wall, and here this is the nasal septum, right? So these are the things. Now let us begin from structures. See, as you can see, the lateral wall is projecting some bony prominences inside the nasal cavity. These bony prominences are called the concha, right? So these are called the concha, and you can see there are three conchae. First one, this superior one, is called the superior concha. This one is the middle concha, and this one is the inferior concha, right? And you can see that there is a space between these conchas. These gaps or spaces are called the meatus, right? These are called the meatus. This is the concha. This superior portion above the superior concha is called the meatus. It's called the superior ethmoidal recess, right? This is called the superior ethmoidal recess. And see, these bony conchas have a mucous membrane above them, right? As we all know, the mucous membrane and skin is above these conchas, right? Now collectively these concha and this mucous membrane are called the turbinate. So superior ethmoidal recess, meatus, concha, turbinates, right? These are the few terms which we must understand in the lateral wall, right? Now let us see a a sagittal section from the nasal cavity. See, this is the section. These are the conchas, right? Now these are the conchas. These will be this portion here will be the meatus, right? This portion will be the meatus, and this above will be the superior ethmoidal recess. So this is the inferior meatus, this is the middle meatus, and this is the superior meatus, and this is superior ethmoidal recess. These are the conchas: superior concha, middle concha, inferior concha, and we are seeing the lateral wall. Now we all know that there are openings in the lateral wall. There are openings of the paranasal sinuses. There is opening of nasolacrimal duct. And what else? These are the main things which open into the lateral wall, right? The openings of the paranasal sinuses are known as the ostium, right? Ostium. Now see, the middle meatus has a rounded elevation, right? Just beneath the middle concha is a rounded elevation present here. This rounded elevation is called the bulla ethmoidalis. Right. This is called the bulla ethmoidalis. Now, just above this bulla ethmoidalis, just above this, there is a sickle-shaped bone which lies above this. This sickle-shaped bone is called the uncinate process. Uncinate process. Right. Now, the space between this bulla ethmoidalis and the uncinate process, this is the uncinate process, this is the bulla ethmoidalis. The space between this, see, the space between this space is known as the ethmoidal infundibulum. The ethmoidal infundibulum. So we saw that there is a round elevation known as the bulla ethmoidalis. There is a bony structure just above the bulla ethmoidalis, which is known as the uncinate process. This is sickle shaped, and the space between them is called the ethmoidal infundibulum. Ethmoidal infundibulum, right? This is the ethmoidal infundibulum. Now, the entry door to this ethmoidal infundibulum, the entry door here to the ethmoidal infundibulum is known as the hiatus semilunaris, right? This is the most important thing right here, the hiatus semilunaris, right? Now, just we'll see once again that there is a round elevation known as the bulla ethmoidalis. The bulla ethmoidalis, above the bulla ethmoidalis, there is a bone above this known as the uncinate process. This is a sickle-shaped bone. The space between the bulla ethmoidalis and the uncinate process is the ethmoidal infundibulum, and there is a hiatus semilunaris, the entry to the ethmoidal infundibulum. So we can write here that the hiatus semilunaris is the entry to the ethmoidal infundibulum, right? This is the entry. So now I hope the concept is clear, that there is bulla ethmoidalis, uncinate process, ethmoidal infundibulum, and hiatus semilunaris, right? Now we will see what are the openings into the lateral wall. So as we have seen that there are paranasal sinuses opening and nasolacrimal ductum. So we know that there are 4 paranasal sinuses, and there is one opening of the nasolacrimal duct. So let us see just in the superior meatus there is an opening. This opening is of the posterior ethmoidal sinus, right? Posterior ethmoidal sinus opening. The hiatus semilunaris, just in front of the hiatus semilunaris there is an opening. Posterior to it there is an opening, and just beneath it there is an opening, right? So in front of this there is a frontal sinus opening. Posterior to it there is maxillary sinus opening, and beneath it there is anterior ethmoidal sinus opening, right? Now we have seen posterior ethmoidal sinus opening, anterior ethmoidal sinus opening, maxillary and frontal. Now the third one. The third one is the nasolacrimal duct opening, which is in the inferior meatus. This is the nasolacrimal duct opening, right? So these are the openings. Now we have we can see there is no opening of the superior sphenoethmoidal sinus, right? The sphenoid sinus, sorry. So the sphenoid sinus opens. See, this is the sphenoid sinus, and this directly opens into the sphenoethmoidal recess. So sphenoid sinus opens directly into the sphenoethmoidal recess, right? Now I hope the concept is quite clear, right?